fully privatized system of Florida that has pretty much completed a gradual privatization over several years almost till complete privatization in 2005. Don Winstead, who is now a consultant, was Deputy Secretary for Children and Families in Florida during that time. One of the things he did specifically was to negotiate Florida's 4E waiver. And so, we might as well just also say that the Florida legislation that initiated the privatization is very much reflected in the legislation that we are looking at now here in Georgia under Senate Bill 350. And so Don has a great perspective on the whole history of Florida's privatization. So, Don.
Thank you very much, Pat. And I'll try in about 5 minutes to cover some of that history that may be at least a little bit relevant to some things that are under discussion in Georgia. I'm going to take you back with me on a journey that started really 24 years ago. Okay, so let's go back to 1990. And in 1990, the department in Florida was an umbrella agency called the Department of Health and Rehabilitative Services, or HRS. And it included child welfare and a whole lot of other programs. And also in 1990, there was an election for governor in Florida, and the person elected governor was a gentleman named Lawton Childs. The lieutenant governor in Florida, the lieutenant governor run is a ticket, so his running mate was Lieutenant Governor Buddy McKay. And at the time, I was previously with the Department of HRS, as it was called, and the incoming governor and lieutenant governor had asked me to serve as Deputy Secretary of HRS. So I was transitioning from one role in the department as an Assistant Secretary to Deputy Secretary. And the first time that Governor Childs and Governor McKay came over to the department to meet with the senior team and outline their expectations as part of their new administration, I went down along with the secretary to greet them, of course, as they came through the front door. And Governor McKay looked at me and he said, "Don, we're going to blow up HRS." And I went, and so I smiled pleasantly, because I thought, a new appointee should do that. And I said, "Well, Governor," and they both were standing there, and said, "Well, Governor, are you at least going to give us a chance to evacuate the buildings?" And neither of them smiled. And I went, "Ooh, maybe not." So there began that conversation. But at the time, and Governor Childs had run a very grassroots campaign, got a lot of input, and at the time, HRS was seen by many stakeholders as being too big. We were an agency of over 40,000 employees, too remote, too non-responsive, and too top-down in our decision-making. And that was the governor's assessment of the department and why he wanted to blow it up. So concurrently, at the same time, in the 90s, there was a recession. And in Florida, Florida's state revenue base is based primarily on state sales tax. We do not have a state income tax, and we, of course, have a balanced budget amendment. So an economic downturn hits state revenues very quickly. And this one hit quick, and it hit hard. When Governor Childs was first briefed on the budget situation in Florida, his comment was he knew his predecessor was passing the torch. He just didn't know he was going to grab the end that was on fire. So we had an immediate imperative also to address and cut down the size of government. So over the next several years, I had the pleasure of shepherding a reorganization bill through the Florida legislature, and we began the process of breaking the Department of HRS into a number of departments. So the Department of Health was created, the Child Support Program transferred to another agency, Medicaid, a Medicaid agency was created, juvenile justice, et cetera, et cetera. So that was sort of the context, was make the department smaller, make it more responsive to communities. Governor Child's transition plan for social services, the title of it was A Community, Not a Crowd. And so community focus was very important. So fast forward a few years, and a gentleman in Florida ran for governor in the other party and ran against Governor Child for re-election, a gentleman named Jeb Bush. And that election of 1994, Governor Child was re-elected, but candidate Bush became aware of an effort in Sarasota County where the Sarasota YMCA was interested in taking over, essentially, child welfare services in that community and had a proposal for that. And Governor Bush was, then candidate Bush, was very intrigued with that and interested in it, but he was not elected. But Governor Childs became aware of that also, and he was interested in going forward. What came out of that in 1996 was a piece of legislation to create 5 pilot sites for privatization of child welfare services, and with Sarasota being the model for that implementation. There then began that pilot. Sarasota first began operating child welfare services in 1997, and then over several years, those pilots went forward. Then when Governor Bush was elected in 1998, he was a key proponent of expanding privatization statewide, and with his leadership, then plans were developed to go statewide. If you read some of the early evaluations of the pilot sites, you'll see references to various outcome measures that were important at the time, and the Florida legislature was just starting in developing performance-based budgeting, and some of that found its way into that. But the impetus behind the initial privatization in Florida was not this specific outcome or that specific outcome. The real impetus was more systemic reform and making the system more responsive to local communities. That was the real key to the reform. So in 1999, a plan was developed for statewide expansion of community-based care in Florida. There began that rollout. It was originally mandated as a 3-year statewide expansion. It ended up, from 1999, those 3 years ended up being completed in 2005. So you can see that it took a little longer than was planned, but was done in a pretty methodical fashion and was completed in 2005. The success of Florida's reform of child welfare involves many factors, but I think there are several factors that were key and are inextricably bound together and very hard, at least for me, to separate. One is the implementation of community-based care and that rollout between 1997 and 2005. A second was a substantial expansion of state resources committed to child welfare. Governor Bush, of course, during particularly his first term, the economy in Florida was doing quite well. State revenue was increasing, and because of his commitment to child welfare and some other social services programs, there was a significant expansion of resources that took place over that period of time. And then a third element was the implementation of Title 4E waiver that Lynn referred to earlier. And the 4E waiver that Florida got and applied for in 2005 and was granted in 2006 then built on the community-based care initiative and gave greater flexibility, and also had the effect of essentially locking in the increased resource level of state and then increasing federal resources. So those three things taken together, I think, were critical to Florida's reform. But while the community-based care initiative and the 4E waiver were very complementary strategies, one does not necessarily depend on the other. I was interested in reading the draft legislation that I saw that both are addressed in there, but I would emphasize they're two different things. And one does not depend on the other for success, and people can give you plenty of examples of both around the country. I think, at least in my judgment, having lived through it for a long time, that community-based care worked well in Florida and was instrumental in improving Florida's child welfare system. However, in working as a consultant and in partnership with Casey Family Programs in a lot of states, one thing that I've learned is that if you've seen one child welfare system, you've seen one child welfare system. And what is learned in one state does not necessarily transfer to another state. So I know I'm probably not the first person to come from Florida and offer opinions about what happened there, but I guess my suggestion would be, as you go forward, is in terms of how your child welfare system works to make lives better for children and families in Georgia, that's really a conversation that has to occur among Georgians. And I think we can bring you a lot of different perspectives and experiences, but you've got to decide what's going to work best. In Florida, that process began 18 years ago, and at least the privatization part of it was completed 8 or 9 years ago. So it's now been there, and it's the normal way of doing things. But I know, we've got a few lessons learned that I'll say maybe for later questions, but as you go forward, I wish you all the best as you decide what road you're going to go down.